Good evening. So, how's your father?
Father reports are normal. Now spoke with me.
Mm-hmm.
He's feeling good. This
Okay.
happens actually. Age is 86.
Mm,
This age, some problem occurs.
okay.
One nurse, one of her relative nurse, she told me it's called vertigo.
Okay,
This happen.
vertigo.
Yes, this happen in this age.
All right. All right.
If you suddenly sit down or immediately
Yeah.
stand up, that happens due to blood circulation is related.
Mm-hmm. Mm-hmm. Okay. So he probably he must have kneeled down suddenly, or there must have been some kind of a
No,
quick
actually,
reaction.
he was while sitting on sofa, he feel that something what is unconscious. So he sit down on sofa and immediately fell down.
Okay.
Oh, yes.
Mm-hmm. All right. So now, so he was at your place here, or he was at Nidhi place?
Native place, native place.
So you
My
rushed.
brother.
So you rushed to that place.
Yes, yes.
Mm-hmm. So your was anybody aware? Like who informed you?
My brother told me.
Oh, your brother was there.
No, no. Actually, what happened, sir? My brother, who is in Paris, he was on vacation.
Mm-hmm.
So he's also at native place,
Mm-hmm.
but he was not at my house.
Mm-hmm.
He actually uh, for for education of his child. He has uh, is he's on rent at different city
Okay.
around 30 kilometers from my native place.
Okay. Okay.
You might have heard Chakan.
Yeah, I know Chakan. Yeah.
Yeah. Yes. He is staying at Khed and his daughter studying at Chakan.
All right. Okay.
Yes.
All right.
Actually, he shifted to native place. His wife was here only. His son having some issues,
Mm-hmm.
so he is anyway at the center.
Okay.
We can say he's not actually mental. He is like us only, but his mind is not developed.
Okay.
Problem is that.
Okay.
And daughter is studying, so he decided almost 1 year back to shift at native place.
Mm-hmm.
And his brother-in-law is a doctor. It's like he's a
Mm-hmm.
professor.
Mm-hmm.
Uh, he is having hospital also at Khed, orthopedic hospital, as well as he's a principal, I think, of that one of the medical college at Talegaon. You might have heard Talegaon.
Yeah, I know Talegaon, which is on the way to
Yes,
Khandala.
Kandal, yes.
Yes.
So he feels that, and even for education, Pune is good.
Hmm.
So they are planning to shift to Pune
Mm-hmm.
in another 1 or 2 years.
Hmm.
So
Okay.
my brothers actually, my younger brother's wife, she used to call every day to me. She speak with my brother,
Hmm.
and around 11 o'clock she called, and my mother told her that this happened. So immediately my younger brother called me as well as my brother. He was at Khed, so he also came within a 1 hour, 1 or 2 hour, and I reached in the evening, night almost 9 o'clock.
Mm-hmm.
And Saturday, Friday, he was not well. Means from his condition, I feel that little bit weak. But Saturday afternoon, he covered, and I told my mother,
Hmm.
give him dry fruit. Dry fruit, not direct you will eat. The dry fruit means like one doctor suggests me
Hmm.
two anjeer, dry anjeer, then
Hmm.
3, 4 almond,
Hmm.
then 2 pieces of akhroat, and 8 to 10 pieces or 7 to 8 pieces of black manuka, black rasin. You to soak in a water for 5 to 6 hours, and morning you wash it, remove the skin of that almond and akhroat, and you can eat that. Immediately will start energetic. You will feel energetic within a week. The
Mm-hmm.
doctor suggests me long time.
Mm-hmm.
So I started that also.
Mm-hmm.
And afternoon, Sunday afternoon, there was an appointment.
Mm-hmm.
And today morning we received reports. All reports are normal.
Mm-hmm.
So I think sometimes it happens
Okay.
at this age.
Right. Right. Okay. Okay. All right. So, all right. Thank you. Thank you for this info. But I would like to make a little correction here in the pronunciation part. Um, you said you pronounced this thing. I'll just write down in the chat box here.
Almond,
Yeah. So you don't call them almond, you call them almonds. L is silent.
almond. Okay, almond.
Almonds. Almonds.
Almond. Okay.
Of course, a lot of people do, they do call it almond, but then the correct one is almonds. And what is akroat called? You said akroat.
Akroad means akroad. You are not aware of akroad?
No, I'm aware, but then I want the English of that.
Akroad. Akroad. Walnuts.
Walnuts, that's correct. Walnuts.
Walnuts.
Yeah. And what about the black manuka? You said black manuka.
The black resins. No?
Right, right, right. You know everything. Why don't you use it?
No, I told you, no, black resins. I told you.
No, you
Manuka
said
seed.
black. You said black manuka.
No, I said black manuka, and after that I said black resins. That
Okay,
also I said.
okay. Maybe I missed it. But then akroat you said, which you did not. So I thought let me just check. But almonds is the correct pronunciation for this. Okay. So henceforth you will be using almonds as pronunciation. Okay.
Right.
Now the next one, as we discussed last time, you're going to have a presentation, right? Are you ready with that?
Sir, actually, I came last night very late.
Mm-hmm.
And today, situation is very terrible in the company. Whole day I was disturbed in such a way
Mm.
that my CHR was running here and there. I think on Friday we didn't. I think I called you. I called you or not, and even that MD fired him. Fired him means like screwed him.
Okay.
Yes. So he was telling me, Rajesh, your and my job is in danger. We have to perform and all that. So it's typical dialogue.
Mm-hmm.
So whole day he was actually he's not planning his work. So whole day we are doing same thing again and again and again. At the end of the day, no results. Again we discuss tomorrow. We will close that. His way is like that. He's spending lot of time in discussion only.
Yeah. Okay. Okay. So you're not ready with the presentation part. Okay. Hmm. So let's do the reading part then. I thought you will be ready with at least one presentation. Yeah. So last time we talked about this platform. I'm going to use the same platform for your reading part, right?
Right.
And mm, okay. So what do you want to read upon? Can you give me some topic? Mm, Pulwama, that you will get in any other articles for sure. Can you give
Okay.
me some other topic which is related to some other, life problems, self improvement, like that, or anything that is coming to your mind? You said vertigo.
Okay.
Yeah, cervical vertigo, and panic disorder. Artificial intelligence every night. Alfred, vertigo. I thought Vertigo. The Vertigo remakes must be destroyed. Remake. Okay. How my battle with Vertigo earned me a pair of reading glasses. The trigger that heals my vertigo with quantum gravity. Shall we pick up something? Yeah. So let's read about this. What is this? God of Vertigo when the world is spinning. Living with Vertigo. Let's read that. Are you okay with it?
Okay.
Okay. Let's go with that.
Okay. If you have never suffered from vertigo, you may have heard about it, or you or know someone who has gone through it. When talking about vertigo, most people relate it to fear of heights and visual sensation that get when looking down from high place. But this is not necessarily true. Vertigo is more than that. It is an illusion of moment, visually spinning, where your whole world gets upside down, non-stop for a certain moment of time. Dealing with vertigo can cause high level of anxiety and stress.
Mm-hmm.
As a vertigo sufferer, I I have gone through it several times within the last couple of years, and I know how daily be daily sorry
How debilitating.
debilitating. Okay, debilitating
Yeah.
it can be.
Now, what is debilitating? Debilitating is when somebody weakens you. Weakens you.
Re-
Weak. Weak.
reconsume.
Weak. Weak. Weakens you. Weakens. Weak.
Okay.
You got the point? Weak. 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 When somebody makes you weak or you feel weak for some reason, so you call that it's debilitating.
Okay,
Okay?
debilitating.
Okay?
In my attempts to okay, in my attempts to solve it, I have visited different specialists and tried different treatment that made my vertigo improve temporarily. But unfortunately, vertigo is always back. After 2 years of dealing with this condition, I decided to take ownership of my own health. So I have done a lot of research to understand why vertigo appears and why no treatment seems to be effective. I want to share my experience and finding with you, hoping this may help you or your loved one while going through a vertigo experience. Let's start by answering some of the main questions that all vertigo sufferers have. Is vertigo life threatening? The short answer is no, or at least not by itself. A vertigo experience can be extremely frightening as the patient does not understand what's going on and when it will stop. A lot of patients run to the emergency room as they assume that they are having a stroke, and they will be admitted to find out. that they are having a vertigo crisis. Most of the time, they will be medicated and sent back home once they feel better. However, I mentioned that it is not dangerous by itself, but it can be dangerous if you get a vertigo attack while driving or while doing some other activity that requires your full attention.
Yeah.
Is
So I think,
vertigo a disease?
I think this is what happened, right?
Yes.
This is what happened when he was engaged in some kind of activity. However, I mentioned that it is not dangerous by itself, but it can be dangerous if you get a vertigo attack while driving or while doing some other activity that requires your full attention.
Right.
Is vertigo a
Is
disease?
is vertigo a disease? It is not. Vertigo is a symptom of an underlying condition that never a disease itself. I have heard some people say that they have diagnosed with vertigo, which is incorrect. So, in order to get better from vertigo, you need to understand the root cause. That will help you to reduce the risk of vertigo coming back over and over again. What kind of specialist treats vertigo? Most patients sees an ENT, ear, nose, and throat doctor as their first option, thinking that their vertigo can be a problem with their inner ear, and some other may see a neurologist thinking that it could be a problem with their brain. What has worked better for me is seeing an autoneuro, autoneurologist.
Autoneurologist.
Autoneurologist, okay, autoneurologist. As this specialist has been trained in neurology, hearing, tinny, tinnitus and vestibular disorder.
Hmm.
How does it feel when you have a vertigo crisis? The experience may be different for each patient, but this is basically what has happened to me. My first episode happened in the middle of night. I turned my head. Sir, please, thoda upar le लो.
Okay. Now let's see the words that we found here. Now, autoneurologist. Now, autoneurologist is someone who is a neurologist but can see the problem which are linked with the hearing aids or hearing natural hearing, the system that we have in human body.
Okay,
Okay, so all these words which are mentioned here, they're all related to that. Neurology is mentioned here, then hearing is mentioned here. Tinnitus is again related to hearing. Vestibule disorders, disorders. Vestibule is nothing but an entry point, as far as I know, because even in houses or even in the buildings, when we say vestibule, it is normally the entry point where you will have that air shower. If you are entering the factory or in a lab where you have a lot of dust control, okay, so you will always have an entry point where you will have an air shower on the top so that your dust is removed and then you walk without the dust particles or any particle that you're carrying in the lab. So that area where such a thing is mounted is normally called vestibule. So vestibule is an entry, in small entry, which is a kind of a controlling entry. Okay, so vestibular disorders. Okay, next, go ahead.
how does it feel when you have a vertigo crisis? The experience may be different from each patient, but this is basically what was happened to me. My first episode
Sorry.
happened in the middle of night. I turned my head while laying in the bed and everything started spinning. Tried to close my eyes, but the feeling got worse as I felt I was going to fall from my bed. My heart rate increased.
Slowly. Give a gap.
Okay.
Yeah.
My heart rate increased increased to 130 bpm and started to feel naus- nausea.
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 Hmm.
I was not able to walk, so I had a crawl to the bathroom. I had to crawl to the bathroom. I was not able to walk, so I had to crawl to the bathroom. It went away after a few minutes, and when I finally thought it was over, I laid down in the bed and it started again. This time I was waited in my bed for it to end. As it was my first episode, I was very scared and I noticed I had that same sensation every time I moved my head, and since that first time my ears started ringing non-stop. This is known as
Tinnitus.
tinnitus.
Tinnitus. So in tinnitus, what will happen? You will have a constant sound in your ear. There will be a kind of a ringing sound. Zzz, continuous. You will keep on hearing that. You know,
Right.
um, I remember in 2019, my brother-in-law had the similar issue. He had this ringing thing all the time. So it's called tinnitus, right? Okay, next.
I have had a few more episodes like this one, but this year it has discovered into something different. Vertigo started to come out of nowhere without head movement. It starts with a fullness sensation in my ear. Then the tinnitus gets louder and finally the spinning. Another thing that changed is that it is does not last minutes anymore but hours with an extreme feeling of dizziness, nausea, nausea and vomiting. While suffering the crisis, it is impossible to walk or move. And once the episode is over, I feel extremely tired and I have a severe instability, so it gets difficult to walk. The best thing I can do after a vertigo episode is sleep.
Mm-hmm.
The instability and dizziness feeling may be last days, weeks, or months, depending on the root cause of the vertigo and the way it is being treated. From my experience, I have never felt 100% back to normal. I have improved, but from time to time, the dizziness appears again, reminding me that vertigo may come back at some point.
Mm-hmm. So did we get any new word here? Dizziness, you knew already?
Dizziness means thaka jaisa na,
Hmm.
dizziness.
Hmm. Dizziness, but dizziness is always, accompanied by some kind of, that you're not kind of feeling stable, you know. In Hindi, if you say chakkar ana jo hai, we will call that
Samajh gaya,
dizziness.
samajh
Yeah.
gaya. Dizziness.
Nausea is in the easiest term, if you can understand it. Nausea is like normally it is more related. I think you will understand better when we have the pregnant ladies. So they always have that nausea feeling, vomiting, little. For anything you give them to eat, they always feel like vomiting out. Okay.
Okay.
So that's nausea. So if we have similar kind of a phenomena, then that's nausea, and that's what I understand that. So I think those are the words that we see here. Okay, let's go further now. What are the possible causes of vertigo?
What are the possible causes of vertigo? According to Alex T.H. Lee, in
You
the
can you
article,
can you can leave that. You can leave that. You go to the next one.
okay,
This is an article reference, which we need not to
okay,
read. Yeah.
Okay.
You can read from here. Vertigo lasting.
Vertigo lasting for seconds is likely to be a Benny, Benny,
Benning.
Benny, Paroxysmal,
Paroxysmal. Paroxysmal.
Paroxysmal,
Hmm.
Okay, paroxysmal
I think
position,
that's a
vertigo.
medical term. That's a medical term.
Okay.
Yeah. Positioning vertigo. So
In,
it's a kind of a type of vertigo that they have explained here.
in simple words, the type of vertigo occurs when the crystals in the ear move through the ear canal, causing waves in the fluid and sending signs to the brain as if we are moving. This is the type of vertigo I had for first time. It can occur while turning your head and even when the reason is not known. Some specialists have related it to low level of vitamin D and ferritin.
Mm-hmm.
Ferritin means what?
I think it's also related to, it's again a medical term. I'll have to only find it out what this is. Ferritin. Ferritin is a protein that stores iron in the body.
Okay.
Okay. So low levels of ferritin and vitamin D. Okay. So yeah.
Vertigo lasting for minutes to hours may suggest main, many hours
Meniers.
Meniere's syndrome or vestibular
Migraines. Yeah.
migraines. Meniere's disease is usually associated with the hearing loss, tinnitus, ear fullness, nausea, and vomiting caused by over accumulation of endo lymph,
Lymph.
endolymph,
Lymph. Yeah.
endolymph fluid in the inner ear. It usually happens when in the ear, but 24% of patients may show bilateral impact. Vertigo lasting for hours to days could indicate an acute vestibular failure like infective lab, labyrinthitis, lab, labyrinth, labyrinthitis, labyrinthitis, labyrinth,
Labyrinth is a word. Labyrinth is a word. Labyrinthid. Labyrinthitis. Labyrinthitis. Labyrinth is a word. Labyrinth is nothing but it's called. It's a labyrinth is you know it's a kind of a thread. Like you have some bottles, a water bottle. You have a cap, and then you have the threads on the top. In some cases, we might even call it a labyrinth. It's labyrinth. Normally, it is in case of when we try to avoid something, like say we have a pump and we don't want water to come out of it. We want the water to be completely sealed, so we will have number of threads like this where we will have the sealants, and then in that case it will be called labyrinth seals. Normally it is called labyrinth seals. It's an engineering term. Okay.
vestibular.
You can start from here. You can start from here.
In uh, labyrinthitis, there is usually a bacterial infection in the inner ear that causes severe vertigo, hearing loss, and ear discharge.
Mm-hmm.
While in the vestibular neuritis, there is an inflammation
Inflammation. Do you know what an inflammation is?
Inflammation. No.
Inflammation. No, you don't know?
No.
Inflammation is किसी चीज का सूज जाना. You know,
Okay.
कोई चीज सूज गई तो we will say it is inflamed now. It is
inflammation.
Inflammation मतलब सूज जाना, कोई चीज सूज जाना, बड़ा हो जाना.
Okay.
Inflammation.
Inflammation of vestibular nerve. Sometimes the cause is viral and there are no other autological symptoms.
Mm-hmm.
Constant vertigo lasting for weeks suggests central lessons caused by a condition affecting the brain, like a stroke or a brain injury. This type of vertigo is more severe and must be evaluated by neurologists. While there are different causes of vertigo, there are just a few studies that can be done to identify the root cause. Most doctors will base their treatment just by reviewing the symptomatology
Mm-hmm.
of the patient, which makes
Symptomatology.
symptomatology
Mm.
of the patient, which makes vertigo a very complicated condition as every patient experience is different. My findings and what has helped me with vertigo. Just to provide a quick background, my first vertigo episode was the BPPV type, which unfortunately at some point it developed into a recent
Meniere's
disease
Meniere's
diagnosis. Meniere's disease diagnosis, but confirm, but still monitoring. For both, this is what I have done and what has helped me to recover and have a normal life. For BPPV, you will easily know when this kind of vertigo is happening because it will start when moving your head and it will last only for a few seconds. As explained, the ear crystal are moving in your ear canal, but once they stop moving, the vertigo disappears. What is BPPV? Repositioning maneuver that consists of a series of head movements performed by a healthcare provider. An example of Ipley maneuver.
You know what maneuver is?
What?
What maneuver? What is the meaning of maneuver?
Maneuver. Example of Ipley maneuver. No idea.
Maneuver is like, you know, whenever we are suddenly moving, like if I'm doing like this, you know, if I'm doing like this activity of mine will be called a maneuver because I'm shifting from my position. You know, I'm talking to you like this, but suddenly I'm doing like this. So I'm my direction is now this way. So it's called, I will call it, say I'm turning towards left, I'll call it left maneuver, for example. In case of in aviation also we use this term. When the aircraft, you must have seen the fighter aircrafts, they suddenly will go towards this side, left side. We'll call it left maneuver, right maneuver, like that. So maneuverability is also one of the feature that we have to have. Yeah, you know. So now, in case of car racers, in case of car racers, they are moving very fast. Suddenly they will move to this side, then go straight, then they will try to overtake somebody else, then they will take another maneuver. So that's called maneuver. Okay, it's a very good word, maneuver. Okay, go ahead, sir.
Your healthcare provider may also teach you how to do the maneuvers at home.
Yeah.
Please note that during the maneuver, vertigo will be triggered. So stay calm. Do not interrupt the moment. Those crystals need to go back to their place so that you can move your head without feeling vertigo. Vestibular rehabilitation therapy.
Rehabilitation. Rehabilitation.
Rehabilitation therapy.
You know rehabilitation,
Once you
right?
are what's a
You know rehabilitation, right?
rehabilitation? Vestibular rehabilitation therapy. Once your crystals are back in the place, you may still have unsteadiness,
Steadiness, correct.
dizziness, and a floating head
Floating head
sensation.
sensation, yeah.
This means you need to retrain your brain to the movement of your head and body. And there are some easy exercise that can be done at home for it. Trust me, that will help a lot. Can
Recurrent.
be recurrent?
Recurrent.
Yes, most
Recurrent.
patients
Recurrent
that
means,
have recurrent,
means,
recurrent meaning
yeah.
can be recurrent.
Recurrent
मतलब
means
बार
it
बार
will,
आना.
yeah, barbarana. That's correct. Recurrence. It has come from recurrence. Recurrence. Reoccurrence. Okay. Occurrence. Occurrence is nothing but किसी चीज का होना. Reoccurrence is बार बार होना. वहीं से recurrent. Okay.
Yes, most patients that have had BPPV are more likely to deal with it again in their lives. With the reason is unknown, it looks like once those crystals have gone out of the place, of
Out of
place
place once.
there is a chance that they will keep doing it
From
from
time
time
to
to time.
time. Okay.
Maintaining normal level of vitamin D is important to decrease recurrent attack of BPPV.
Yeah. Okay. Okay. For
For
Meniere's
many
disease.
disease, you may identify this type of vertigo if your episodes last for minutes to hour, appears for no reason, your ears are loudly ringing, and you have hearing loss. In many in many experience, I had all the symptoms except for hearing loss. However, the otoneurologist suggests that it may occur in the future. Okay. What has helped with Meniere's disease? Listen to your body. Pay attention to your any changes so that you can identify your aura. The aura is that early sign that you your body will. I think
I think it should be your body, yeah. Your body.
your body will send you before a vertigo episode. As
Mm.
soon as you notice your aura, make sure to take the medication indicated by your doctor and stay home or in a safe place.
Mm-hmm.
Remember that once the vertigo starts, the spinning will not let you move or walk. So it can be dangerous if you are outside or driving.
Hmm.
This severe vertigo usually causes nausea and vomiting for hours. It can be very painful for your stomach, or if nausea and vomiting do not stop, ask your doctor if you can take any other specific meds for it. In my case, my doctor prescribed medication for vertigo but also medication for nausea and vomiting to help with specific symptoms. Avoid watching your phone screen or your TV during the vertigo episode. I know closing your eyes sometimes make it worse. So what has worked for me is to keep your eyes fixed on an object. Once the episode is over, I am usually exhausted, so getting a good amount of sleep helps a lot. Change your diet, avoid salt, caffeine, and alcohol as they are considered important triggers for menial attack. If you feel unable, if you feel unbalanced the day after the vertigo attack, the vestibular rehabilitation therapy will help, but make sure to do it for enough time to retrain your brain. I have been doing this therapy for months. General recommendation for any kind of vertigo: stay hydrated, avoid.
What do you mean by stay hydrated?
Stay hydrated means drink water,
Okay. Number two.
avoid lying flat on your back. Try to sleep semi upright until you have no symptoms. Take it easy when getting out of bed. Take your time, move slowly to let your inner ear adapt to the new position of your head. This will reduce your chances of triggering an episode. Reduce stress and anxiety. When we are in a stressful situation, our body has physiological reaction that will increase risk and severeness of vertigo episode. And on the other hand, the vertigo episode will increase your stress and anxiety. So you do not want to be on this endless cycle. Meditation has worked great for me, and there are other activities like aroma,
Aroma.
aromatherapy and yoga.
Aromatherapy.
Yeah, aromatherapy and yoga can help as well. Stay calm and breathe. As the vertigo attack is hitting you, internally repeat that you are not in danger. Keep in mind that this is temporary and that will be okay. Do not let anxiety take control. It will only make it worse. You are not alone. There are a lot of amazing vertigo supports group on Facebook. You can connect with them anytime. Reading everyone's experience helped me to understand what I was feeling. If you know someone dealing with vertigo, please be kind. Even when it is an invisible condition, be aware that it is very debilitating
Yeah,
and
debilitating.
extremely scary. It affects your simple aspect of their life as they cannot move as they used to. This cannot play. They cannot play with their children. Some of them cannot drive anymore since moving their head can be difficult, and even sleeping has become a challenge. Let's be supportive and provide a community where they can feel safe. As a psychologist, I know vertigo also affect mental health in several ways. If you are dealing with vertigo and your anxiety is all over the place, taking control of your life, please do not hesitate to find help. You are an amazing person going through a lot. The therapy can provide you with, with tools and not let this condition affect the wonderful life that can deserve. Thanks for reading. Hope this article helped you in your vertigo journey.
Yeah. So, what lessons did you learn from this reading, sir?
Sir, two things I learned. Uh, I came to know new words. Second thing, for me, it's really difficult to read fast in a proper manner. That I also came to know. But when joined this class, that time my reading was different. I think I have improved, but that is also not very good. But at least person can understand what I'm talking. That is first thing. Second thing, I have to improve my speaking pronunciation, and I have problem with some words which I have not heard. Then pronunciation.
Hmm. So, I think what you rightly said, that improvement definitely is there from your initial time. I think your video is stuck. Is your network having a problem?
No, no, they don't, not aware, but I can hear you.
Okay. So, now definitely there is an improvement because you're doing good. You're reading nicely now, and getting stuck, and finding new words, and then the challenges you face in pronouncing all those words, that's absolutely fine, because you're trying something new. You have tried a different topic altogether, which you are not familiar with, which you have not heard about. You have experienced it recently, and that's why you are little familiar about the whole issue, the vertigo part. Yeah, can I have you again? Yeah, I just lost him again because of the internet connection. Yeah, just trying to message him now. Getting connected again. Thank you very much for being there in the live session. And that was loud reading that we practiced. And in the process, we read about, I mean, how somebody lives with vertigo, because the client who was reading the article, his father has recently suffered a vertigo issue, and that's why we picked up the vertigo topic here. And obviously, it was very useful, and there were a lot of information that you could gather while reading this article. Lot many new words, and of course it was somebody's personal story, so probably it will not be that tough to relate and imagine his situation or imagine his father's situation during the course. So that's what happens when we do a loud reading. What are the things that we learn and how it benefits us? Thank you very much. We'll get connected again in some other session, a live session. Thank you very much.